So you've been part of a previous MRFF application which was successful. Can you give me a brief outline of the unsuccessful application that we're here to talk about today?
Yeah, sure. So, look, this proposal was all about working together with young people to co develop a treatment program, also working together with service providers to really sit down, workshops, consultations to co develop a program to help treat alcohol use disorders among young people. And we know that this is a really critical area to target because it's the peak risk period. Young adulthood is the peak risk period for alcohol use disorders. So we've got new data just coming out that says 1 in 3 young people at the age of 24 has an alcohol use disorder. We also know there's all sorts of repercussions at this time, profound repercussions for the individual, but also society of these problems. So we wanted to really work together with young people and try and develop an innovative new approach that would really be tailored to their particular needs.
And is there anything like that out there? And I guess the second part of that question is the
Yeah,
consequence of not doing that research, given that it is
yeah,
what, the fifth largest killer of young people, is that right? Which is
absolutely.
astounding.
Yeah, yeah.
So yeah, the consequence of inaction and
Yeah.
what else is out there.
Yeah, so okay, so the first question in terms of what else is out there, and I'll talk about the repercussions, but the first question, there are other programs out there, but what we wanted to do is really develop a new approach. So it's an online program, but it's adaptive. So what this means is that it's tailored in two really important ways to the individual. So it's tailored in terms of the content. So the content adapts and is customized according to the person's individual reasons for using alcohol, which is different. It's vastly different from one person to another. And the susceptibilities that get them stuck are also different. So the content is adapted, but also the level of support is adapted because for some people, just an online program is not enough. There's lots of advantages of online programs because we can scale them up, we can reach lots of people even in regional areas where they don't have access to services, but it's not suitable for everyone. So by assessing along the way how the person's going, check-ins, we can then adapt the level of support and provide telehealth supplementary when somebody needs that extra support. So it was really innovative in that way. The consequences of not doing this, as you said, alcohol is one of the leading causes of death and disability. And I always say every single death, injury, disability is caused by alcohol is preventable. We have the opportunity to really prevent those. The harms, things like health, poor educational outcomes, poor employment prospects, loss of productivity, but also things like crime, self-harm, and suicide rates are all increased when we're talking about alcohol use in a young person. And cost, just to put it in really financial terms, $66 billion. So the Australian Institute of Health and Welfare has estimated $66 billion per year are associated with alcohol-related
It's,
harms.
it's quite astounding when I mean, there's a human cost and there's the huge economic cost, $66
Absolutely.
billion dollars. And in the scale of the Medical Research Future Fund, your grant application was for a reasonably small amount of funding, right?
Absolutely.
And
Less than
so
2 million.
so exactly, so less than 2 million to have such a big impact on something that's not a one size fits all proposal by the looks of it. It was something that's adaptive and fit for purpose, for can be individualized in a way.
Exactly.
So where to from here?
Well, look, like the MRFF has really been a lifesaver in terms of funding new research. I've had other research funded through there. It's really enabled us to innovate and to develop more effective interventions. So we're going to keep trying, I guess. We have to get this funded. We have to get the work funded because there's not something like it out there. We know that young people, I mean, really, if you look at mental health of young people in Australia and globally, it's really deteriorating at the moment. So it has to be a priority. So we'll keep applying to get it funded.
It kind of sounds like a no-brainer, though, the way you're explaining it to me. And obviously there are lots of competing priorities when governments are looking at things, and not
Yeah,
everything can be funded. And we do
yeah,
great research, so
yeah,
there's that.
yeah.
But I think the frustrating thing, or it's almost inexplicable, that it's not that we're asking for new money; it's that there is money there to fund this, and so all the option left for you is to keep knocking on doors, right?
Absolutely, and we do knock on doors widely. We try to get it funded however we can. But I guess just when you were talking about that that frustration. We see with mental health, particular among young people. So 4 in 10 young people have a mental or substance use disorder, and yet the investment in mental health research does not at all match the scope of the problem. So I guess we're really just saying, make it align with the number of people affected, the economic cost of these disorders, put the investment in so that we can actually prevent these problems, because like it's trite to say, but prevention is better than a cure. If we can get in early, and that's why young people for me is really the focus, get in early when the unhealthy patterns are just emerging, because once you've had a 30-year history of an entrenched disorder, it's really, really hard. Yeah, not unfixable, but really, really hard. But if we get in early when young people are still forming those patterns, we can really make a big difference.